Good morning, everybody who are attending this webinar. I'm Dr. Bhatt. I'm on behalf of Param Institute of Education. I welcome all of you. Today, I'm going to give you a brief idea about the Certified Billing and Coding Specialist course and the field of Billing and Coding Specialist. So, Param Institute of Education is located in Islin, and we are conducting various allied healthcare courses. Certified Billing and Coding Specialist course is one of the very important course, very useful course for all of you, those who wants to pursue this. So let us have a discussion about what is Certified Billing and Coding Specialist. So the word itself has two meanings, like one is the medical billing and one is coding. So what is medical billing? Medical billing is the process of submission and follow-up of claims with health insurance companies to receive reimbursement for services rendered by healthcare provider to the patients. All of you are well aware, when you go to a doctor, you have your health insurance card with you, and doctors examines you, he treats you, but you don't know what happens with the payment regarding your treatment given by the doctors. So the medical billing and coding specialists, they are working behind the screen to get your payment from the insurance companies. The billing process is an interaction between healthcare provider and the insurance company. So medical biller and coder is a very important person who links between the healthcare provider and the insurance company so that your reimbursement can be paid to the healthcare provider. All procedures of this interaction is known as a billing cycle. It is also known as a revenue cycle. So this, to get the reimbursement from the insurance company, it has many steps. So all these steps are taken care of by the billing and coding specialist. So we have to know the process of billing insurance carriers, and we have to understand insurance terminology for filing and appealing the claims. The process of billing is same for most of the insurance company and most of the healthcare programs by the government. Now let us see what is medical coding is. So to get the reimbursement from the insurance company, every billing and coding specialist has to file one claim form, and that claim form requires information in the form of codes. Like whatever the diagnosis is done by a doctor, it is not written inside the form in the form of alphabetics, but it is assigned in the form of codes. What diagnosis is done by your doctor, that is also translated into the codes, and it is communicated to the insurance companies. So these codes are known as ICD-10 CM codes. All the codes related to your procedure, your treatment, they are known as CPT codes. Apart from this, there are certain special codes which gives communication to the insurance companies for the drugs which are prescribed to you, or the equipments which are prescribed to you. In the learning course, you will learn about ICD-10 codes, you will learn about CPT codes, and the modifiers. Modifiers are the supporting two alphabets that we use with the codes to support additional services or the procedures that is rendered to the patients, and it is communicated to the insurance company for additional reimbursement. An insurance claim starts when patient has contact with the healthcare provider, and it ends when you receive a payment from patient or insurance carrier. So it is the whole cycle which has around 14 steps in between. So when patient comes to the doctor and doctor receives the reimbursement from the insurance company, it has 14 steps in between. This slide is just to give you about what is this ICD code. Now let me tell you what is ICD. ICD is an international classification of disease. You might have heard the name of the World Health Organization. So all the disease conditions are given codes, are given numbers, and these numbers are known as ICD codes. So here you can see on your left of your screen that 496, 414.00, V53, 55.3, these are the ICD codes for the various diseases. On your right, you can see P09, S32.010A, 09A.211. These are all ICD-10 codes. So ICD-9 was developed by the World Health Organization before 30 years. But with the years of new disease revolution and new disease identification, the codes which were there in the ICD-9, they were not enough. So ICD-10 is now revised by the WHO, and it is adopted by the USA in the form of ICD-10 CM codes. What is CPT codes? So CPT codes are five numbers which are used to provide to the care which is provided to the patient, and these numbers tells insurance companies that what kind of services is provided to patient. And according to this code, reimbursement is given to the healthcare provider. Now I told you that all this reimbursement can be gained back by giving information in the form of claim form. So here you can see the one part of the claim form where you have to enter all the details about patient's occupation, address, patient's health insurance, and the part 2 of the claim form. Here you can see where all the informations related to disease, treatment provided to the patients are entered inside it. It is very crucial that as a successful biller and coder, you complete the claim form without any mistakes, because all payment and reimbursement is based on how you punctually prepare and submit the claim form to the insurance company. So now most of the students ask me that why we should go for this course. So let me tell you that biller and coder is an important post for any healthcare institution. It can be a private practice, it can be a group practice, it can be a hospital, nursing home, because the revenue which is gained by this institution, it is done by the biller and coder. This profession is listed as one of the fastest growing profession in allied healthcare industries. After the implementation of ICD-9 CM from October 2015, medical industry is experiencing a tremendous demand for individuals with knowledge of billing and coding operations. According to American Medical Association, more than 1.2 million medical billing coding jobs opportunities are there in the United States at present. So it can be a lucrative field for you for your future. Then let me tell you that who should do this course. So the people, those who are interested to do office work in medical practices, those who are willing to work with hospitals, nursing homes, but not in the clinical field, they want to work with the office, then they can do this course. Those who are not interested to do physical work, because it is the work of medical billing and coding specialist is totally a table work, and it is all mental work that you have to do. Those who are not willing to work in fixed time spells and shifts, here you have an advantage that medical billing and coding specialists, they can work any time schedule, but it is all depends on your workload and your punctuality of the work. Those who are having basic interest in medical science, insurance, and accounting, because all this course and the work, it is related to all these subjects. Those who are good with computer operation, those who are having good communication skill in English, those who are having good communication skills, and those who are having punctual, polite, they're perfectionists, having patience, and who are ready to work with the healthcare industries. So if you have these qualities, you should do this course, and you can work successfully as a medical billing and coding specialist. So now you will have question that what are the subjects that you will learn by joining this course. So the course is having multifaceted subjects. It includes basic anatomy, physiology, medical terminology of body systems. Why we have to learn all these things? Because whatever is written by the doctors in medical records, whatever diagnoses are there, whatever treatments prescribed by the doctor, they're all having medical terminology. So unless and until you don't understand the terminology, you are not able to find out the codes for the diagnosis. You are not able to find out the codes for the treatment which is provided by your doctor, and you can miss the reimbursement. The other subject which is there in the course material is fundamentals of billing and coding profession. Then the third aspect is finding out the codes for the diagnosis from ICD-9-CM and ICD-10-CM. Fourth aspect is identifying the codes for the procedures which are carried out by the doctor for providing treatment to the patient. Along with this CPT codes, you have to learn about modifiers. You have to learn to find out the other HCPCS codes. The fifth aspect of the course is you have to know various types of health insurances, some private health insurances, managed care organization, Medicare, Medicare, CHAMP VA. So these are various types of health insurances to whom you have to deal with to get the reimbursement for your doctor where you are working. So you have to understand their reimbursement requirements. You have to understand the terminology which are used by the health insurance fields. Then the sixth aspect is you have to know the rules and rules of generating claim form and rules of submission of claim form so that you can get the reimbursement in time. Here you have to create, we generate this claim form which is known as a CMS 1500 claim form through one software which is known as a Medisoft. So we also teach you how to generate the claim form using Medisoft software. Apart from this, there are various legal and ethical aspects that one has to know when they are working as a billing and coding specialist. So, and this is also an important part of the course material. Then the procedures to track and to get paid for pending claims with insurance companies. So once you have submitted the claim, then your next duty is to track your claims, whether that claim is accepted by the insurance company, whether that claim is rejected, whether it is denied or suspended. So there are various methods that we will teach you to track your submitted claim. And the last but not the least, the legal methods to collect account receivable from patients by applying knowledge of various acts. So this is the whole comprehensive program where you learn from step 1 to step 14, which includes all the aspects related to be a successful biller and coder. Because of this comprehensive course material, it is totally 240 hours of classroom teaching. And after you finish your classroom, you will be sent to a billing company for 60 hours for the externship, where you can learn about how to do hands-on experience, how to work practically in the field of billing and coding specialist. Now, you might be having some doubts about what kind of exam is this that you have to clear to become a certified billing and coding specialist. So this examination is taken by National Healthcare Association. It is an online exam where you will be having 120 questions, which are all multiple choice questions. You will be given 120 minutes. You don't have to go anywhere else. Param Institute of Education is an NHI approved exam center, so you will be giving your exam here only. And the important thing is this certification is valid all over the USA. If you shift to other states of the USA, you can work as a certified billing and coding specialist if you have this certification. You can have your exam results immediately after you submit your examination, and you will have immediate certification. So if you work hard with the course classes, it is very easy to pass the exam. They ask you about the concept that you learn in the theory of various subjects. Now, after you pass the test and you go for the job, what can be your job responsibilities? So here, let me tell you this: you are doing multitasking. It is an attractive and diversified job responsibilities are given to you when you are working with healthcare provider. This job is challenging because you have to be in the pace of any new or any any additions in the codes and the rules and regulations, then you have to apply that. You are dealing with the customers, you are dealing with patients, you are dealing with insurance people, you are dealing with other paramedical staffs and doctors. You have to do data collection from patient, hospital, insurance companies, laboratories, and other physicians. You have to keep updated knowledge of rules and regulations of various health insurance plans. Coding of diagnosis and procedure precisely is very important task and the job when you are working as a billing and coding specialist. You have to update your knowledge about any recent changes in the codes or any recent changes in the procedure codes. You have to do bookkeeping of various transactions of the patients in your office. You have to keep accounts of all the patients. You have to check that which patients you have received in reimbursement, which are the patients you are still waiting for the reimbursement. Banking is also one of your job responsibility. And last but not the least, follow up of the claims with patients and insurance company. This is very crucial part of your job so that you can generate enough revenue for your practice. So the ultimate goal of a biller and coder is perfect and timely processing of health insurance claim form and necessary follow-up with health insurance carrier and patient to receive maximum reimbursement in time. So once your doctor is getting reimbursement of all the patients which he has provided care, then your job is done very well. Now, what should you require to do this course? You can take this course if you are a high school diploma or having GED. We will provide you additional knowledge of medical terminology, anatomy, physiology, medical ethics, medical legal issues, diagnostic and procedure coding, insurance claim completeness, office work, and computer and the Medisoft, how to work on Medisoft software. Now, where can you work after having these certifications? So there are plenty of avenues where you can work. You can work in the medical offices of so many specialties like physician, surgeon, orthopedic, pediatrics, obstetricians, gynecologists, anesthetists, chiropractors. You can have job in nursing home. You can have job in long-term care centers, hospitals, daycare centers, hospice centers. You can work with medical billing and coding service providers. And after certain years of experience, if you are enough eligible to work and enough confident to work, you can have your own work from home. You might be having issues regarding what are the salaries that a medical billing and coding specialist can have. So the average salary for the billing and coding specialist for the freshers, it is $14.54 per hour. But yearly income ranges from 21,000 to 45,000. You can, if you are working good, you can have a share in the profit, and you can have bonuses for your good job. But let me tell you that the knowledge, work experience, and continuous performance are very important factor for your earning. For most of the part, certified billing and coding specialists enjoy their work and report high levels of job satisfaction. Now, why you should select Param Institute for this course? Let me tell you, Param Institute of Education is a NJ State approved and NHA affiliated vocational school. We are located easily nearby the Metro Park station, so it is easy accessibility by road and train. We have affordable fees compared to other vocational schools in our area. We make easy payment plans. You don't have to worry about the fees and everything. We also accept one-stop career candidate. We have qualified and experienced faculties. This course is taught by the 3 people. 2 of them are medical graduates, and one of them is an experienced billing and coding specialist, having experience of more than 15 years. We teach by using modern techniques. We also provide you online practice test to the students for the preparation. Our school is having collection of the books, and they are all available on net. You can have free access to e-library. We also provide you mock examinations before you appear into final examination. Our passing rate for the certified billing and coding specialist course is more than 80%. All our students, they are happy with us. They are working in the field of billing and coding specialist, and they are successful. We also provide free extra coaching for the students who need this. We have supportive administrative staff. We have we provide personal attention to each and every student. We don't enroll more than 5 students in one batch. We provide assistance in resume preparation and employment by our HR team. And here we have a good news that if you are enrolling today, you can have a discount of $300 by the school authority. Our next classes are starting from August 22nd. Please call us and join this class because your success is our satisfaction, and education is our passion and not the profession. So I have one question from one of our attendee that how do ICD-9 and ICD-10 codes differ? So let me tell you in brief that ICD-9 codes were prepared 30 years back, and these codes are having 5 alphanumeric digits. ICD-10 is having more digits, 7 digits. The code description which were there in ICD-9, they are having much more detail in ICD-10. So nowadays, because of the implementation of ICD-10, every billing and coding specialist must know medical terminology in much detail. They must know physiology, pathology, and anatomy in much detail. Then they can successfully find out the codes from ICD-10. We have 4-hour lectures for ICD-10. You can come and join with us, and you can learn how to find out the codes from using ICD-10 CM code books. For more details, you can visit our website or www.paramedu.com. You can watch video testimonials from our past students. You can call me on phone number 732-283-5656. My extension is 5108. You can visit our institute at 200 Middlesex Essex Turnpike, suite number 105, Islin, New Jersey, 08830. I also welcome you for our next webinar. We have our next webinar on Friday, August 19th. It will be on the subject of sleep trainee step introductory course. So I welcome all of you to join with us on this webinar. You can have idea about what this course is, and this is again a very important education. You can have it. Thank you so much.